It's been said that everybody's got a story to tell. Well, the person we're about to meet tonight, there's no group of people in America more prepared to argue their constitutional rights.
That's how we connect to each
Yeah.
other. That's how we connect to our communities. And that's what we tried to do here
Yes.
at the cafe.
Greetings, everybody. I'm Earl Caldwell. Welcome to Hampton University, to the Scripps Howard School of Journalism and Communications, and to that sacred little entity we call the Caldwell Cafe. There are no students on the Hampton campus. The university has been closed for more than a year. Courses are delivered online. Students scattered just after spring break a year ago. It's the pandemic. COVID-19, the deadly virus that has struck more than 30 million people in the United States alone. The death toll among victims is inching towards 600,000. In the midst of all this destruction, finally, some good news. Effective vaccines developed in record time are being distributed across the country and worldwide. However, distribution has become an issue. Simply put, the people hardest hit by the virus are now the ones having the hardest time gaining access to the vaccine. And that problem breaks along racial lines. The virus continues to savage Black America, yet Black Americans are having the most difficult experience trying to access the vaccine. The crisis has Black Americans looking to a history that says organize and mobilize. Institutions across the country are responding, and Black colleges and universities, the HBCUs, are rising to the challenge. Ordinarily, our cafe gatherings involve breaking bread with interesting guests while debating issues and ideas, but not this time. We gather now to introduce a special report, COVID-19, the color of fear. Somehow, in the Scripps Howard School, Dean Plummer found a way to produce this special report, to get the kind of solid information people need to understand this vaccine crisis that has engulfed Black America. This special report includes a medical perspective with Dr. Keith Newby, a cardiologist and founder of Fort Norfolk Medical, and Megan Hill, a certified health specialist at Hampton University, and the Reverend William Scott, an elder at Temple Beth El in Suffolk. In addition, two of our students put together a most impressive introductory package. It sounds like a lot. That's because it is a lot. It'll be worth your time. Check it out.
The coronavirus pandemic has stirred up the entire world. The virus itself has claimed more than 2.43 million lives worldwide, with 490,000 of those lives within the United States. However, a large portion of those lives taken come from minority communities, with the Black community being one of the most prevalent. So today, we'll take a look at not only the reasons as to why, but what some local Hampton community leaders are doing to help fix this racial inequity.
The Urban League is our organization in Hampton Roads is an affiliate of the National Urban League, which is the oldest civil rights organization in America, well over 100 years. And we focus on 4 pillars, primarily for the African American citizens of our communities, and that's in health, education, workforce, and housing.
The National Urban League is a historic civil rights organization dedicated to economic empowerment, equality, and social justice. With 90 affiliates serving 300 plus communities in 37 states, the Urban League spearheads the development of social programs and authoritative public policy research, all while advocating for policies and services that close the equality gap.
In particular, we focus on housing and the issues within particularly public housing communities, and then the healthcare. And in that area, we've formed a number of coalitions and partnerships to collaborate with community leaders to attempt to provide information as well as assistance to our citizens. We've joined forces with the faith-based community, pastors in the African American community, one because of their influence, two because they have a megaphone to reach a wide number of people, and there's a trust factor so that when we then in turn join with the healthcare community, particularly Centera Healthcare, where we did testing in public housing communities. We did it in senior citizen homes, as well as with the homeless community. Those folks who may not have transportation to travel for drive-through testing. So we found that there's been this wonderful collaboration of people coming together, and I can only hope, and I really believe that once this crisis subsides, that these coalitions will remain and grow.
These coalitions have led the Urban League to work with local health organizations, local church organizations, as well as create long-standing relationships with groups such as the NAACP.
The NAACP has really stepped up nationally and really have questioned our leaders, the White House as well, on how the African Americans and Black and brown people are being handled. This inequities with health has been going on forever in our community. COVID has just risen it to another level.
With the presence of COVID-19 becoming detrimental to the lives of everyday minority communities, we now rely on these communities and their leaders, such as Pastor Carter, to aid in the safety of all who reside in them.
I serve as the Vice Chairman of the Planning Commission in the City of Hampton, along with working with the grassroots community and making sure that social and civic actions are addressed to make sure that the community needs are met. Being a part of the faith-based community, most of the pastors, we've got together and we pooled our money, not from the church, but personal finances, where we pooled $150 a piece. And what we did, far as the first responders, we sent snacks to the doctors and the nurses and the paramedics and everybody, first responders. As far as the community, New Hope Baptist, since this has started, we have served over 700 meals to youth and seniors under the direction of Minister Terrence Shelton, our youth minister, who has been doing a marvelous job, along with other churches like Ivy Baptist and other churches who have worked and been serving those persons that's underserved, the youth and the seniors, making sure that those seniors from this point getting their medications, getting the resources that's due. So most churches are working within their confounds and making sure that their congregants, especially the least of these, our needs are met. We're still doing the streaming live and on Wednesdays and Sundays, and we're communicating by way of streaming live or robocalling. Right now, I'm erring on the side of caution that I will wait to probably late June, early July before we open up the church to the congregants. And still, we would take precautions when we do that. As you know, persons are still scared. The unknown is still there, and we want to make sure that we protect our congregation and everyone. So we're still streaming and still doing things remotely.
As Pastor Carter stated, many are taking the side of caution. That caution not only comes from the fear of contracting and possibly spreading the virus, but it also comes in the form of many being fearful of taking preventative measures, one of which being the vaccine.
Unfortunately, it's rooted in history, factual history of things that weren't necessarily good that happened to African Americans a century ago. I'm reminded of the Tuskegee syphilis experiment, and those vestiges of what happened then have lingered, and they've rooted themselves in a fear that I frankly understand. And our effort has been to communicate that the fear should no longer exist.
Fear. It's a feeling that has plagued minority communities for years. Luckily, we have community leaders such as these men and women that work day in and out to ensure that we have nothing to be afraid of. With this, I thank you all for listening. Continue to be safe, wash your hands, wear your mask, and I hope you have a blessed day. Thank you again.
Joining us now is Megan Hill. Ms. Hill is a Hampton University's certified health education specialist. She's also a member of the university's infectious disease and prevention working group. It's very nice, Ms. Hill, for you to take time out to join us and bring us up to date on what is happening in the university. It's been just about a year since there have been no students. Tell us where we stand now and what you see, and bring us up. You have the knowledge, you have the information. Share it with us, please.
Awesome, thank you, and hello everyone out there. As we just discussed, so yes, we are looking at bringing students back in the summer as well as bringing students back in the fall. And so the infectious disease working group, as well as the university, as well as the president actually released a letter this week discussing being able to have all the students, requiring all the students to be vaccinated, as well as the employees. So unless you have some kind of medical contraindication or a religious exemption. So right now, that's where we are. We're making efforts to mitigate strategies to mitigate COVID-19 and have a phased approach into bringing students back and repopulating the campus.
Will the students have a hard time getting the vaccine? It seems that they still haven't really gotten the older people and so many other.
Right. And so with that, we do take that into consideration based on the phased approach. I don't know if you've been keeping up with some of the news and things like that, but they are trying to have a quicker rollout for vaccines and availability of the vaccination. So hopefully by summer, it'll be easier to access the vaccination in order for our students to have that vaccine as well.
Well, the president speaks very optimistic about that. He says we're going to have
Right,
everybody
right.
before summer. So hopefully
Exactly.
that will be. What we're experiencing now is something that, well, I would suppose no one in this country has ever been through anything like this. I'm wondering, how do you look at it? You're a professional in this field, and you're seeing this thing is exploding, not just in this country, but around the world. What is your take on it?
Well, just like you were saying, this is something we've never seen before. So it's about adaptability. So that's what we're seeing go on. Everyone is kind of in crunch mode as far as health and safety protocols. You see the CDC is putting out different guidelines and things like that, but everything, like we said, is new. We can go based on the science and how pandemics work and looking at the way the spread occurs. However, we still don't really know. And so that's the thing. To me, it seems as if we're doing it right, because yes, the numbers, some places are still going up. However, we do see that steady. And then we also see the decrease of some numbers in certain states. So it just really depends on just in general mitigation strategies and then things that are in place for people to help actually slow the spread. So ideally, everybody has to do their part, and that's going to be the main thing, making sure that everyone does their part. And so as being on campus as a public health person, just making sure that everyone is aware of what is needed in order to prevent and decrease their risk of COVID-19 is something that is very, very beneficial.
I've been very taken with the university, what I thought was just a genius idea of getting this mobile unit. Could you just tell us about that? That could take the needed healthcare to places too.
Right. And so that was the concept of the mobile unit that they have right now. It has started going out. I believe it will be in Surrey, in the rural Surrey area later this month as well. But the idea was making sure that accessibility to those who are under vaccinated. So the African American communities, the rural communities, the low income communities, Hispanic communities, the elderly communities, just making sure that the vaccination as well as testing is available and accessible. Because that's one of the things we already know, that African Americans, we're still less likely to receive that vaccination. And so with that, if we take accessibility off the table as a barrier, that's something that would allow the African American population and community to actually be more likely to get vaccinated.
Speaking of getting the vaccination, are you convinced that the students will be receptive to the idea that they all must get vaccinated? And it not just if a few of them get vaccinated, it has to be that virtually all of them, right?
Right. And so that's the thing. I haven't really received any feedback so far from the students to kind of gauge to see how their response to being required to vaccinate. I work with the certified peer health educators. However, like I said, they haven't provided any feedback or anything regarding having to get vaccinated. The letter actually came out after our meeting, so I might have a little more insight on that next week. But with that population, just young people in general, the sense of I'm invincible, and I can't get COVID-19 is something that will be a barrier. So that's where the education comes into play, and then accountability, holding everyone accountable for their neighbor and the campus community.
Right.
But like I said before, sometimes you will see some pushback within that generation and college age students, because like I said, they, a lot of times they think that they're invincible and nothing can happen to them. So that is something that will definitely, be a possible barrier. But with it being required, I don't necessarily feel that our students would, provide too much feedback. Too much pushback regarding that, since they do want to come back to school. That's something that is actually working at our favor. People are trying to get back to normal, and a lot of the students really want to come back to campus. So I think they will be open to it, just so they'll be able to come back to campus.
We are joined now by our second guest for this section, Dr. Newby of Norfolk, Virginia, Keith Newby, I would say a prominent cardiologist, and also been looking at his background, coming from part of a very famous family of doctors. I was taken about that. I said, wow, medicine, that's their family business. Well, welcome. It's nice to have you.
Well, thank you. I appreciate it. Good to be here.
And we were, Ms. Hill from Hampton University. I don't know if you two know each other, but she was telling us about how things have been coming together at the university. And I'm hoping that you would speak to us about the larger community, where we are, what you see and speak to the urgent needs that exist across this area.
Well, essentially, the biggest issue has been just getting people more in a mindset of protecting themselves and doing what's necessary to make sure they protect other people. Getting this vaccine as relates, essentially, this COVID issue is predominantly what's been driving everything in the United States and across the globe. The biggest issue I've noticed is just the aspect of getting vaccinated as a potential protective mechanism. For some reason in our community here and at large, we're running to an issue of getting people to want to become vaccinated. I've found in my experience, half of the patient population, or half the population says, I want it no matter what, give it to me, when can I get it? I have probably about 30% of people, or maybe 35% who are on the fence.
Right.
They tell me, well, I've been thinking about it, but I wanted to talk to you. And I get quite a bit of that. And then there's about 10 to 15% say, I don't care what you do, I'm not taking it. You can put a gun to my head, pull the trigger, I'm just gonna die without the vaccine. And so I got that mix of people that we have to get in the mindset of saying, I need to become protected and I need to protect other people. So that's kind of where I see us globally right now is just trying to get people to that idea to say, yes, I want to protect the community by doing what I need to do for both myself and for my loved ones.
Dr. Newby, of the group, that 10% that you speak of, that say they don't want to touch the vaccine no matter what. What age group is that? Is that scattered through the ages, or is that mostly centered and clustered in some?
What it's interesting. That's an interesting question. I tell you what's been my experience. It's a spattering of all age groups, but predominantly I'm finding more of the younger people saying that than the older patients. And it's kind of interesting because you get these conspiracy theories. We are living in the age of disinformation.
Yes.
And that has been a major problem I have had. And I've had to do everything in my power to fight that disinformation scenario. I'm seeing that the younger people are trying to quote, and I get, these are the various things I hear. The first thing is always they bring up Tuskegee. That's always the first thing that's brought up.
Right.
So, but I'm going to be that kind of doctor. I'm going to fight the system. You tell me Tuskegee, I'm going to say, well, tell me what happened at Tuskegee since you brought it up.
Yes.
And they'll say they experimented on no, give me details. Don't give me that global thing. You brought it up. Tell me what happened at Tuskegee that's making you say that. Probably 90% don't have a clue at what really happened at Tuskegee. And it's always the younger ones I'm seeing that's saying that. So we get that off the table. Then I've heard other conspiracy theories about, I've had one, somebody said they're injecting a microchip in you. I asked them, I said, well, why they want to do that? Because they want to know what I'm doing. So I had one patient, I brought this up on one of my radio programs, and I told this one patient of mine, I said, listen, man, I said, let's keep it real. I said, you broke and you have no job. What does anybody care what you're doing on a day-to-day basis? I said, let's get real. I said, that is not, I said, and the cost of injecting a microchip in you and following that, who wants to spend that kind of money? I said, so I nixed that one off the table. Then the most recent one I've heard is they get biblical on me. And then they say, well, this is Revelation and the virus is part of the apocalypse. And they said, if you accept the vaccine, then you're essentially accepting the mark of the beast. I said, okay, all right, well, let's get biblical then. I said, you're saying that, how do you know that this is not like the 7 plagues of Egypt and that the vaccine is like the blood of the lamb that they had to put over across your door? I said, so how do you know that's not the case?
Right.
Of course, then I get that deer in the headlight look as they're trying to say, listen, you jacking my conspiracy theories here. I'm like, that's the whole point. I said, we have to really start looking at what we're trying to do. I said, listen, if your feeling is that white people are trying to kill you, I said, ask yourself this, why go through the process of giving you a vaccination? Why not just let you go and do what you've been doing and get the COVID and die? That's easier to do that and a heck of a lot cheaper. So I said, for everything you tell me, I can give you a rebuttal against what you're saying. So that's kind of, I know that was a long drawn out answer to your question, but I wanted to give you that kind of realm of what we're seeing. But I'm getting back to your original question. It's the young people I'm running into more problems with that don't want to take it than the older patients who you would think, if you're going back to Tuskegee, you would say, okay, if I'm gonna pick a group of people, that would be the group that you will want to, you would think would be anti-vaccine because they were living in that time to experience that kind of scenario. The younger folks hadn't seen any of that, so I'm not sure where all this comes from, but I tell you, that social media stuff, man, is killing us. Social media can be a system of good, but unfortunately, so it's not regulated. So when people are saying what they want to say up there, that's what we're running.
And they get a very large microphone to carry it. Miss Hill, in a way, Dr. Newby's talking about you. He's speaking exactly. You're trying to get these kids to take the vaccine. So do you have is there any kind of pressure that you could see that you could, or is it just a persuasion thing?
It's definitely going to be some persuasion as well as education. Just like Dr. Newby was saying, there's a lot of this information out there. And so basically changing the narrative and reframing it and making sure that they have the correct information, and learning how to basically teach them how to navigate through, you know, the misinformation and miscommunication, because just like we were talking about, social media is a beast in and of itself. And
Yes.
so being able to give them the tools necessary to decipher what is factual versus what is opinion, and what is a credible source, is something that I definitely work on, being in the health education field, and just making sure that the correct information is getting out there. For the campus community, all through COVID, I have been sending out information and messaging and things like that throughout the entire time, to make sure that, at least coming from here, they're getting the correct information.
Dr. Newby, the larger Black community, which suffers from a lack of medical health care across the board, this has really come to light during this pandemic, because the community, the Black communities, brown communities, Native American communities are really being devastated. Do you see anything coming together at this point that is going to bring something into being? And I know this new president is committed to raising the healthcare, those who are not, where that is lacking in their communities. But do you see anything coming together to make that a reality?
Not as of yet, but I think as Ms. Hill was just mentioning, the right information has to be conveyed. One thing I'm noticing, and I was thinking as we were talking about the issue of the younger people and why they may be more apt to not want the vaccine. And again, it could be the fact they're on social media all the time, and that's where all this disinformation is coming from.
Yes.
So if they're hearing this, it's almost like I found you have to have, it has to be a concerted effort from people like Ms. Hill, from myself, from other people who are really attached to the African American community, and we deal with this population every day. I mean, and I consider myself as being a part of that community. They're going to be looking for people like myself and others who are medically knowledgeable to help navigate those waters. So it's almost like you have to have, for every 10 negative messages, we have to have 50 positive ones.
Right.
That's going to overshadow those negativity schisms that we're seeing on a day-to-day basis. So it's not going to be necessarily, I think, President Biden, although I will say having a positive message versus what we had previously, right, is going to be a positive thing in and of itself. Yes. However, it's going to be, it has to be almost a grassroots, on the ground, boots on the ground effort to, I think, to bring this community together to see the advantages and the benefits. Until they hear from voices they trust, they're going to listen to other people, who are just going to be saying whatever they need to say and not say anything that makes any sense.
Right.
Did you hear that thing? What's it, Eric LaSalle? Did you hear that thing he did the other day? We talked about that microphone that you brought up, and he says the downside of social media is people have access to the megaphone, as he said it, but do they have the responsibility that goes along with it, having that megaphone? That's where we're running into problems.
And yes, and everyone just seems to be, there's no effort, there's no, I think everybody is very cautious to put any regulation on social media. Although the biggest microphone was President Trump's, and they took it away from him.
Yeah, so I think that's going to be important. That regulation, and it's not to say you shouldn't have a voice, and I agree with free speech, but responsible free speech,
yes,
right,
is where I think that's where the rubber meets the road.
Yes. Ms. Hill, last word.
Well, that's what I was going to say as well. Just making sure that, especially when it comes to health information, because that's something that is detrimental. If people are getting the wrong information regarding their health, that is something that can be very detrimental to society. And then also, as Dr. Newby was saying, having people that look like the population. So, us, the three of us having this conversation right now as people of color is something that would be beneficial because we are giving information to our community. And
Right.
so a lot of times you will see that when information comes from people that look like you're a little more receptive. And so I am a big advocate of holistic care as far as, dealing with medical practitioners and physicians, as well as, behavioral health and sociologists and public health specialists and as a whole. But if we have more Black and brown people in those positions and in those roles, our community will actually it's a possibility that they will be more trusting. And so that's really my concept and why I'm such an advocate for holistic health as well as prevention and preventative medicine. That's something that I'm really an
Thank you so
advocate
much.
for.
Thank you so much. Dr. Newby, you have the last word.
Oh, well, thank you. Well, from as far as I'm concerned, the biggest thing is protecting ourselves and our family and loved ones. I tell people all the time, I said, look at the world like this. When you say you don't want to take that vaccine and you risk yourself, which is your choice to do so. However, how is that going to impact people you know and love? If you don't take it and you get COVID, you give it to somebody else and they go on to die. Do you feel that you're okay with that concept? If you feel like that's okay, then hey, that's something you have to live with. But I know personally, my Christian beliefs don't allow me to be that selfish. I have to look at the world beyond just the scope of myself. I have to go home to my wife and children every night. Do I want to risk infecting them with COVID-19 and something happened to them because I just didn't want to take the vaccine because of a bunch of propaganda that really has no bearing? So I would say take into account how what you do impacts other people. And I think that will at least help guide you, hopefully down the right path.
Megan Hill, Dr. Newby, thank you both so much. We appreciate
Thank
it.
you. Thank you for
Thank
having
you.
me.
Thank you for having us.
Joining us now is the Reverend William Scott. He's an elder at Temple Bethel in Suffolk, which is one of the largest congregations of Black Jews, I would say, on the Eastern Seaboard. Reverend Scott, it's so nice of you to join us. I know that you've been busy today. In our prior conversation, you told me that you were involved in getting the vaccine to some of the residents in the Bell Harbor senior citizens facility on the property of the church.
That's correct.
Yes. That takes me to this. You were doing this today because of your relationship with Centera, which is the big medical provider, healthcare provider in Virginia and North Carolina. And Centera has 12 hospitals. One of the hospitals is on land that it leases from you. Is that right?
That's correct.
Yes.
That's correct.
Take us through that, will you? And how that links up with your being able to provide this much needed vaccine to people such as your congregation.
Well, Professor Caldwell, first of all, so glad to see you again. This is a culmination of a plan that was put together by our former leader, Rabbi Plummer, to develop the land to be used for the betterment of humankind. And we came into a relationship with Centera because they were interested in providing services to an underserved community in Pughesville, Huntersville, and the surrounding areas. And so they approached us, and so they built a building. And then they realized that there was a larger community to be served, and they built a $75,000 expansion. And so this is the second phase of their offering to us. They began by doing screenings, health screenings for the COVID-19 virus. And subsequent to that, when uh, vaccines became available, they approached us again. And we're very happy with this relationship because it seems to undergird a need that exists in the underserved community.
In this underserved community, that is its problem. It doesn't have these relationships. There was a big story in one of the local papers not long ago about a group of churches in the Norfolk, Newport News area had come together in a consortium to get the vaccine. And they had worked out a deal that I think they had 20 churches. And so when it came time, they received 2,000 doses of the vaccine, which was good, except the demand from these churches was over 12,000. And
Yes.
and this is the problem now. There is a demand for the vaccine, and this demand is coming largely from those communities that have been hit hardest by the vaccine. I'm sorry, by the pandemic.
Yes.
But they don't have that connection that you have.
Well, I'm happy. I'm not happy for them, but I'm ecstatic for our relationship. When you build trust and you educate the community, they will respond. Just to give you an example, the success rate for people of color in our agency at the William H. Plummer Plaza Senior Housing Facility is over 87% as of today.
Wow.
That includes African American, Asian, and Latino. Relationships do count. Trust and education are two key factors to the success.
So your relationship with Centera goes back what? How far back does it go?
I'm not certain of the years, but it's probably in the neighborhood of 4 to 5 years at this point.
And you keep
because they had. I'm sorry.
No. Go ahead.
There was a need to design and construct and all of those things. So I believe it's close to 5 years already.
Wow, very interesting. Do you see? You have a model? Are these other religious institutions in the Black community aware of what you've been able to do? And have you know of any other initiatives to try to develop something similar?
Well, we have a decided advantage in that we had available land. You know that typically in our communities, with redlining, with all of the problems of access, they can't really go out and build a facility such as Centera did on our property. That's one of the problems. Secondly, attitudinally, we have to spend a lot of time convincing our constituents of the value of seeking health care, regardless of where it comes from.
Right.
And of course, the socioeconomic delimiter is a factor.
Elder Scott, you have a very long relationship with the church. How is this pandemic, this COVID virus that is striking such a horrible blow against not just this country, but around the globe? How is this being taken within the religious environment? How do you explain it to your flock?
Well, we had to change our modality. Typically, we worshiped in person. And we are a very active congregation in that there's a cappella singing, there is movement throughout services, and we had to adopt the medium of virtual worship. But deep within the roots of our beliefs is that God is omnipresent and that God is reachable wherever you are if you will seek to find God. And so we focused on the value of praising God, giving him thanks for whatever he has allowed us to have, just the breath of life, just the availability of the electronics. We surfaced people who had never done this before, and Zoom and YouTube were very, very viable avenues for us to reach each other. So we have really bonded. I believe it's really been an asset just to be able to desert the constant negativity and focus more on the goodness of God.
It's not seen as a punishment for behavior.
No. You know, when you look at the family structure, what this pandemic has meant to bringing families closer together, you know, I'm sure that there are many, many parents who had their own distractions just to survive, has found a new meaningful relationship with their children. Um, you know, when times get hard, you know, families tend to bond. But when you know you have soccer and you have this and you have that going on continuously, and then there's the iPhone and the iPad and the what have you, families have grown apart. But this has been a forced entry into relationships among families.
Elder Scott, thank you so much. I wish we had more time. You've been very generous and we appreciate it. Thank you.
Well, it's a pleasure. And may God continue to bless you and your efforts.
Thank you.
Thank you.
We are joined now by our two student contributors. Kyle Snipes is in Atlanta, Georgia, and Emmanuel Young is in New Jersey. He's just outside of Camden in New Woolridge, just across the border from the great state of Pennsylvania and the mighty city of Philadelphia. I hope you guys enjoyed your experience in helping us put this together. You did a lot of good work, proud of you. And in the wrap up, I'd just like you to both reminisce a bit with us. Tell us what you encountered that gave you pause, what you've seen that sticks in the mind, and anything people ought to know. Let's start with you, Kyle, in Atlanta, Georgia.
Got you. I do have a couple of stories to tell, but I'll definitely try to keep it brief. Well, I guess I'll start with what I spend the most of my time with, and that's usually at work. I work in the film industry here in Atlanta, and I've worked on 5 sets so far. 2 being a set PA, 2 being COVID compliance PA, and on my current set right now, I was working COVID compliance, then I switched to a utility technician. And one thing that I've noticed out of all of the sets that I've been on, as you go, there's even more strict COVID restrictions. And as my job, when I was a COVID compliance PA, I had to make sure that everybody, you know, they had their KN95s. They had their face shields when they're within 6 feet of somebody, you know, just making sure that people adhere to the rules. And of course, there's always going to be people that don't adhere to the rules. And the thing that has struck me now that I'm on my 5th is that every set that I've been on has had multiple cases, either 1, 2, or 3. And, you know, of course, the wrong person gets it on a film set, it's over. You know, the whole production is over. And I've seen that happen to a lot of people, luckily not myself, but I've seen it happen to multiple movie sets. And, you know, that says something. And along with everything that we've spoken about during the show, death rates and statistics also say something. And with that, you know, like let's go outside of work and just take my city, for example. I live in the east side of Atlanta, and I promise you I can leave my house. I promise I'll see well over a handful of people walking with no mask on. You know, I see it all the time, whether I'm going to the grocery store, you know, just regular public places. You know, there's always gatherings. I probably haven't been, I can't tell you the last time that I've personally been to any major event, because for me, I feel that shows not just character, but it shows that I care about society. People that walk around with no mask on, in my opinion, that shows a lack of regard for society,
Right.
lack of regard for your fellow brethren. And what I want to say is something that I would like for people to sit and think about, you know. And like I said, I'll be sure to keep it brief, but like let's do theoreticals. Let's say you walk around maskless simply because you don't want to have one on.
Right.
And I've seen this happen a lot. Let's say theoretically you contract the virus, but you're younger though, so your immune system is fine. But let's say you sneeze or cough or have some type of transaction of germs with a friend or even a stranger. They contract whatever you have, like in the case that they do, that's putting their life at risk. But we can go even further with that. That person doesn't know that they've contracted it.
Right.
On any symptoms. And, you know, of course, we see this with statistics. They go home to their grandparents, their little sister or brother, or even baby child, whom have weak, vulnerable, and at-risk immune systems. Let's say even one possibly passes away. This could be traumatic for many. You know, it's a life-changing event. That could be the father of 3 boys. It could be a single mother of 3 daughters, a grandparent taking care of their grandkids. So many different types of people in possible situations. And the only similarity between them is that you have now affected somebody's life forever.
Yeah.
Simply because that person lacks the integrity, the initiative, the self-control to follow a simple act such as wearing a mask. And for me, like working, I wear a mask 12 hours a day when I'm at work, or I'll get fired. But if I wouldn't have gotten fired for that, I still would wear my mask, even if that wasn't a thing. And that's simply because I personally care about my society, my fellow brethren, my parents. My dad right now, he's 78. So I have to make sure that even though while I'm working, some people like to take their mask off every once in a while. I don't do it under any circumstance because I can't have something bad happen to anybody else.
Right.
Yeah, I mean, I just like to end this by saying, if you don't want to look out for yourself, at the least look out for others. You know, at the least get vaccinated.
Yeah, I see where you're coming from. Absolutely. Emmanuel, what do you see? Tell us about some of your experience.
So unlike Kyle, I've actually had quite the opposite here in New Jersey. Going outside, I live in a smaller community, so everybody has masks on. People maintain their distance, and my neighbors, who are both, their husband and wife are both doctors, so they've always taught me the best ways for masks, or how to make sure I don't get contracted, because my dad, like Kyle's, he's quite older and is more subjugated to getting coronavirus. So I always make sure I wear my mask whenever I'm out writing an article or a story or going out to take pictures. I always make sure that I have hand sanitizer in my car. And lately, a lot more people have been getting vaccinated here in New Jersey. So people are starting to get more vaccinated, including the warehouse districts where I live in. Most of our utility workers are getting vaccinated now, including people in the schools. I myself was actually able to get vaccinated as well.
Fantastic. I'll let you in on a little secret. We had earlier in the broadcast a woman who is a health expert from the university, and they want to bring students back next semester. She said, but look, the president says that everyone's going to have to be vaccinated, and wondering, a lot of people, well, we had another fellow on, and he said that about a physician said about 10% of the people, Black people, are saying no to the vaccine, and that most of that 10% are younger people, which surprised me. But he said it's social media where you get a lot of these conspiracy things and all that. Okay, gentlemen, listen, we appreciate your work. You guys did heavy lifting, and it's great. You gave up some spring break too to do it. But if each of you has a quick last word, you got it, Kyle.
Just to reiterate what I said before, just get vaccinated.
Yeah.
Make sure you care about everybody else, and that's pretty much all I would have to say.
Okay, we appreciate your contribution. And Emmanuel.
Same as Kyle, just get vaccinated. And if you choose not to wear a mask, at least respect the people that are like subjugated to the virus, and just help out wherever you can, whether it's doing just helping out for neighbors or distribute or give masks or buy masks or do groceries for them any way possible.
Okay, gentlemen, thank you too. Thank you both. Appreciate it. Hope I'll catch up with you when you get back here on campus. All the best.
And then you have to wait for 15 minutes.
It's gonna take you 15 minutes to give it to me.
No, I'm giving it to you.
You already had it, Earl.
Good.
You already gave it to me?
Yeah. If that's all it is, right? What's everyone complaining about?
Yeah.
Yeah, that was a piece of cake, huh?
Absolutely.
So you just have to.